Welcome to Vet Candy, where we talk about the hottest vet news. Thanks for joining us today. This is going to be great. I'm Dr. Michelle Moyal, an assistant clinical professor at the College of Veterinary Medicine at Cornell. I focus on primary care surgery.
And I'm Patrick Carney. I'm an internist, an epidemiologist, and also an assistant professor at Cornell. My teaching focus is on primary care.
And on this episode, we are talking happiness. Yes, this is the happy episode.
One in two dog parks have worms? Interceptor Plus is a monthly chew that protects your dog from not only heartworm disease, but all 5 major worms. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Patrick, so we are talking about my absolute favorite topic, and the truth of the matter is, it's happiness.
That's a good topic.
I think one might say that I'm generally happy most of the time here.
I don't know that I've ever seen you not happy, and it's usually very obvious.
I do feel pretty lucky to do what we do, and I love being a veterinarian, and I know it's not easy. And I know that there are days when we don't feel happy, and we're going to talk about a few things. But let's just start with client happiness. How do we make them happy?
It's a good place to start, and also the eternal question of being a veterinarian.
Yes.
So I think a lot of it may involve, as we've said in many contexts, good communication skills. But on top of that, potentially thinking of new ways that we can interact with clients beyond the confines of the typical vaccine appointment. So are there any new things that you can think of that might engage your clients?
Sure. Well, I mean, I think convenience is one thing, right? We want to make scheduling appointments and getting their preventatives ordered super easy, right? We can engage with them on social media. We could have posts. Sometimes I think it's a great idea, and I'm sure a lot of hospitals do this. They have events for their clients, right? They have pictures with Santa. They have like dental month. They have like costume contests during Halloween. All of those things are super engaging and make clients super happy because they want to see their pets be the highlight.
I agree, and it's really fun to be able to interact with them in a context that's not purely clinical.
100%.
So you start to see what your clients are like outside of the exam room, and they get to see kind of a more human side of their veterinarian as well.
Absolutely. My dog looks great. Like, we have an Ewok costume that's just fantastic. And so these are the engaging events that we could have for them that give them some happiness. But I want to talk about appointments. And it's really important to me because I think sometimes we don't realize that we have moments where we can engage with clients more than we do. An example of that would be what I tell students, right? So we have a tendency, we really want to get a history. We're focused on the client's information that they're giving us. And what do we end up doing? We're typing, looking at a computer. And so a large focus about what I teach students about building a relationship with clients is as simple as eye contact, right? Engaging with them, letting them know that we're really listening. I know we want to be efficient. I know. But it's those little things that help build relationships and in turn build a level of trust and then happiness.
I 100% agree. So much of the fun of being a veterinarian is not just the interaction with the animals, it's actually starting to establish long-term relationships with the client and the patient. And being able to engage with them starts there. Just that initial contact, eye contact, getting down and saying hello to the animal really makes the client know that you care about them, you care about the pet, and things just get better from there.
I love that point. As a matter of fact, I had gotten so many compliments in practice just because I would actually greet the pet before I would greet the owner. Like, I'd be on the floor like, I love you. And so obviously that's not for everyone, but it was just a really nice way to engage our client. And so they were so taken by the fact that I was taken with our patient. And that really set a tone for the appointment.
Yes.
And I really think that the other thing we can consider is maybe talking about the beneficial effects on pet owners of having pets, right?
That's a huge one.
Helps with anxiety, helps with depression, has beneficial cardiovascular effects. I mean, these are big things.
Yeah, and it's something that I don't know veterinarians talk much about, whether it's because we don't necessarily know about it, or it's just, again, we're focused on being efficient and we miss out on this extra dimension that could really enrich the relationship.
Absolutely. I think some studies have been done on this.
Yeah, so 3/4 of millennials say that if their veterinarian talked about how pets make their health better, they would be more likely to really be willing to engage with that veterinarian and would be more willing to come in and visit them.
That's pretty awesome. And I don't think a really difficult thing to mention, right?
No, it's 10 seconds. It's One Health. It hits all the boxes for being good medicine and being good client relations.
Yes, it encourages exercise. Like a pet relationship encourages exercise and a sense of, a deeper love than some. I mean, we've all been in practice, right? We've met people who have amazing relationships with their pet and maybe not the same relationships with people. It's a different kind of bond.
It really is. And it's sometimes a safer bond for people. So I think realizing the depths of those bonds and highlighting it, telling people of the advantages, really can make them bond with you as a veterinarian and as a person.
Absolutely. That human-animal bond is critical for us to take care of our patients. I also think a neat thing to consider is offering DNA testing. Is that controversial? I think it's awesome.
I think it's a great idea. I know so many clients that really just want to know what went into the making of my dog, and they now have them for cats as well. So it's an easy thing to do. It's something that clients get really excited about, and you also can get some health information out of it. So it's really a win-win scenario, and it's kind of showing them that you're not just there to give shots, you're there to talk about the entirety of their pet, which is great.
Absolutely. As a matter of fact, I did do a DNA test on both of my dogs. And when I was waiting for the results of the DNA test on my most recent dog acquisition, we actually posted on social media to allow people to guess what breeds he was, and whoever came closest. So they would make a small donation, $5, $10. And then whoever guessed right got a gift card. We gave them a gift card. And then we donated all of the proceeds from everybody voting to the Humane Society that we got him from. So what a nice opportunity to give back to.
That's a fantastic idea. So how close did you get?
Not close at all.
Yeah.
Not close at all.
That's pretty typical. Apparently about 1/4 of the time, veterinarians have managed to guess the predominant breed in a mixed breed dog. So we're supposed to be the experts, but when it comes to guessing breed, the genetic tests have shown us up.
What? Shepherd Cross. That's the answer.
Pit cross.
Pit Cross. Okay.
Yep.
We have our answer.
Domestic short hair.
And these are the kinds of moments that really can help foster happiness in our clients. And that in turn fosters return visits, return business, best care for our patients.
Absolutely. Happy clients also ensure financial success for your practice.
Absolutely. And in order to make happy clients, a part of that has to be a happy staff.
100%, yes.
I think more than ever, we have to take a pretty critical look at our staff, and this includes all of the staff, veterinary technicians, assistants, doctors, and think about their well-being.
Yes, and it's something that's getting more prominence, but I feel like we're still in the early stages of getting to the root of the problems in veterinary medicine's well-being crisis and finding good ways to address them. So what are some of the things you found to be effective in promoting a happy staff?
Oh boy, that's a great question. I would tell you, and I think this may be, an old rule of thumb, but everyone listen closely. Buying pizza or buying lunch is not going to cut it when your staff is burnt out for the day, right? So we have great technical staff. We appreciate them. We have great associates, but unfortunately buying a meal to account, to make up for days and days and days of back-to-back appointments, not being able to eat, not being able to use the restroom, unfortunately isn't enough, right?
Yes.
And so I think we have to have really serious conversations and promote well-being at our practice. Not say, hey, go do what you need to do maybe on your day off after, you've been slammed for days. I think we need to have a talk about, do we need more staffing? That's not an easy question. I understand that. It's not easy to just suddenly get more staff. It's been pretty tough for many hospitals, but just things to think about, things to talk about with your team, right?
Right.
How can we make this better for you? What do you need, right? So I know that it's easier said than done, but sometimes even just listening to what your team needs goes a long way.
Right.
And the other thing, and I'm going to make a big deal about this, is we have to pay people appropriately.
Yes. We need to pay people what they're worth.
Absolutely.
And I think it's important to bring this up because there is a shortage of technicians, and we're struggling to fill those positions, but there's probably a shortage of technicians because it's not really reflected as a career that's worth entering at this point. There's poor pay, there's high burnout. It's the highest turnover of any veterinary health profession. So addressing those causes makes it look like a more attractive career. And at some point down the road, we should be able to have technicians because it looks like an attractive career option.
I've been so sad. Some of the best technicians I've ever met, by the way, veterinary technicians have been an integral part of my education as a student and as a doctor. Losing them to the human medical field is pretty devastating. One, because I think our profession really benefited from having these amazing people there.
Yes.
But they just couldn't afford to stay in vet med.
And that's such a shame. There are so many really talented, really caring people, and we need to make sure that they are valued for the contributions they make. And that is monetary compensation, but it's also making sure that they're recognized and appreciated for the skills they bring and the work they do. And as you said, pizza's not going to do that. It's really a culture shift to make sure that the entire culture of the practice reflects appreciation and respect for the contributions of every member of the team.
100%. And when we say, paying your staff appropriately, we're also talking about doctors. Now, that being said, I want to make sure, I kind of elaborate on that statement. Unfortunately, the gender wage gap is still a very, very prevalent thing. And so I think wage transparency would go a long way to getting, having quality doctors stay at your practice. And again, paying them what they're worth, equal pay for equal work.
Right. And I feel like it seems like that should have been shifting as the profession shifted from predominantly male to predominantly female. But for some reason, we've still lagged in that. We have long since passed parity in terms of numbers, but we're not there on pay. And that's contributing to a culture of really depression and poor mental health.
100%. There was a study that came out of Cornell here that talked about the wage gap, and that, it took women, even specialists, 20 years or so to kind of achieve the same level as some of their male counterparts. And female practice owners still did not make as much as male practice owners. I don't understand where this disparity is coming from. So something has to change. Something has to be shifted. And I think it has to start now.
Absolutely.
Right. So we're talking about the wage gap and making our employees happy and, paying our technical staff and support staff, what they're worth. And the same thing goes for our associates. I guess the question is, how do we make this better?
That is the key question. And I don't think anybody has the answer. I think it's a whole bunch of pieces, and we're still trying to tease a lot of those out. But a huge part of it is probably education. I think there are a lot of people with good intentions, but there's a lot of unconscious bias. That's something that has been, I think, talked about a lot recently, but we're still kind of figuring out what role it plays in veterinary medicine, and we need to do a better job of being aware of it.
Absolutely. And it's called that for a reason, right? A lot of us who think we have no issues just may not realize. So this takes a lot of self-awareness, a lot of, stepping back to assess the situation, look at your employees, look at what you're paying them, talk to your hospital manager. A lot of work will go into this, and that's not easy, especially when you're a busy veterinarian, busy practice owner. But there are resources for you, right? And my fear also is that it's not only women. My fear is that if we are talking about unconscious bias, that it will affect people of color, some of our LGBTQIA veterinary staff and associates. And so my fear for them is not only will they not have a sense of well-being, but they also will not be paid enough. So all of these things are like compounding factors to their happiness.
Absolutely. And a lot of that is, as we said, education, being aware of the biases. One of the things that's really challenging is that often being aware of biases isn't sufficient to correct for them. So as you said, there's a lot of kind of metacognition that needs to go into it to really assess your own motivations and your own susceptibilities to those, and to actually strategize on how to combat those biases. Even then, often the correction's not complete, but it's a start. And then there are places we can go from there, like working on inclusive environments and making sure that everybody feels safe and heard and protected.
Absolutely. And I have to tell you, as an employee of quite a few practices before I came here, I would have loved to have heard that, my practice owner or hospital manager were doing this type of training. I think it's super meaningful to the people that work for you and work under you to know that you're trying. And that, in essence, makes them try.
Yes.
Leading by example.
Yes, and I agree 100% that seeing the effort being put into it is really, really important. If you're just checking the boxes, okay, we did diversity training, we did unconscious bias training, moving on, I think you're undervaluing it, and your staff are going to see that and react to the sense of dismissal that seems to convey.
Absolutely. I am going to mention one thing that I think can lend to happiness that I was just thinking about as an associate. And again, this can be tough, but what I'm hoping some practice owners that are watching might consider is belligerent clients. Clients who are just being absolutely terrible to your staff, terrible to your doctors. I mean, I've had clients curse at me. I've had them, almost get to a point of, being fearful. I was fearful of physical violence. I mean, these are the clients that unfortunately I think that we have to fire, right?
Yes.
And so as an employee, seeing someone who was, incredibly belligerent and angry at me and upset and yelling or screaming or making me fearful, these are the people that I don't think we should have as part of our practice.
Right. And it's a profession where a lot of us are people pleasers and we're conflict averse. And so we think it's easier to avoid conflict with that client, but it's making everybody's life a little bit more difficult. And that really accumulates over time. So your staff seeing that you're going to go to bat for them, that you're preserving and protecting their well-being is really important.
Yes. And I think, having done this for quite a while, we've been in this profession for a long, long time. There was that the client or the customer is always right kind of attitude. And I just don't think that attitude has a place now.
Yeah. And I think it's been interesting, especially in the context of the pandemic and the great exodus, people quitting jobs. There's been a lot of re-examination of that client is always right. And it turns out that that's always been a misinterpretation, or at least an abbreviated version. It's supposed to be the client is always right in matters of taste. So I'm not going to dictate to the client that they like the meal I served them in a restaurant. That's a matter of taste. But they're not right that I didn't give them the food. If they claim that they never received a meal and I know they did, they are not right. So I think that helps to kind of contextualize what we're talking about here. The client is right in matters of taste, but in matters of fact, in matters of human decency, they may not be right, and it is okay to call them out on that.
While we're on the topic of client happiness, I think an untapped opportunity, and I'm sure some hospitals are using this, is telemedicine. I was looking though in JAVMA that some places had telemedicine as an option and our owners weren't quite using it as much as they anticipated. But I think it would be a great opportunity for us.
I think it really has a role in trying to ease some of the pressures that veterinarians feel to see the increased number of clients and patients that we've been faced with lately. So it's definitely an untapped resource, as you said. I think one of the issues may be visibility. It's so new that clients may not be aware of it, and we're just not used to putting it out there as an option. It's one of those things in a busy day, it might kind of fall out of your mind as an option for some patients.
Yeah, and I think it's a little intimidating. All of us really want to have our hands on our patients, see them, know what they're feeling. But again, if we have a huge caseload, then this is an opportunity for a client to feel like their voice is being heard when they're concerned when you can't get them in. Right?
Yes.
And so I think that there are opportunities now. This doesn't necessarily have to happen just with the doctors at your practice. They don't have to take on an extra burden. There are some other resources for veterinarians to outsource.
There are. So after hours care, telemedicine is an option for after hours care. And there may be some programs out there that have profit sharing so that when your clients are referred to this telemedicine service, your practice still retains some of that revenue.
Yeah, and I think some services offer veterinary specific care, like veterinary technicians answer the phone. They can help direct these owners to, an emergency hospital if they need to, or if they maybe could just wait, but allaying the fears may be worth the cost for sure.
Yes, I think another good place that telemedicine could serve us is the rechecks. So you have a urinary tract infection and you don't necessarily need to reculture the urine. The new guidelines suggest that if they are asymptomatic, you don't care if there's bacteria in the urine. You don't need to continue treating. But we still may want to touch base, and we may want to touch base in a little more depth than just a phone call. So you can schedule it as a telemedicine appointment. That earns a little extra revenue for your clinic. It makes sure your follow-up is really complete. And that's kind of a pop-off valve opening up appointment time for the more critical cases to be seen.
Absolutely. And sometimes we all know this, a recheck is missed, or the client gets a call from, the customer service team and they're like, my pet is great. But when they talk to the doctor, doesn't matter where, they're like, it's mostly better, but, a few accidents, but it's better. Right? And so that allows us to recheck. And then again, we progress to additional testing if we need, more revenue, better patient care.
Right. And we've been talking about client happiness in this context, but I think being able to take some of the burden off of the technicians seeing a high caseload through telemedicine is going to benefit your staff as well, especially if those are appointments that may not be utilizing their skills and abilities to the greatest extent possible.
Yes. And then if we have, a frustrated owner who is just really concerned about their pet, we hopefully don't have them inadvertently taking that out on our customer service reps who are just trying to answer the phone and respond to them as kindly as possible, who are also very, very busy.
Yes, they are in the line of fire and they often inappropriately catch some of that ire of your clients. And this is a much more appropriate venue for those discussions to happen.
Yeah, so it sounds like telemedicine, although intimidating because it's a little bit of the unknown, can be a really valuable asset and tool for overall happiness of your client and your staff.
Yeah, and I think one of the really great things is that we're in kind of the beginning stages of telemedicine, and a lot of the state veterinary practice acts still don't really have this built into it. So there's room for input from all of our viewers, all of the veterinarians out there, to try and mold what this looks like. It's not that telemedicine is going to replace in-person visits.
Absolutely.
It's that we can shape this to be something that maximizes the happiness and the well-being of ourselves, our clients, and our patients.
Much like human medicine moves in a direction, and it seems that veterinary medicine just is like a step behind but moves in the same direction, I feel like that this is going to be something that needs to be explored. And so it would be neat if a lot of us were on the forefront of starting that in veterinary medicine. So I'll be interested and excited to see what people come up with, and if people are doing it already. I'm sure there are many practices that have adapted it as a result of the pandemic. So that concludes this episode of Vet Candy. I'm Michelle Moyal.
And I'm Patrick Carney.
Thank you so much for watching.
Not all preventatives protect your dog from heartworm disease and all 5 major worms, leaving a gap in their coverage. Close the gap with Interceptor Plus. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Hi, I'm Shannon Gregoire, and welcome to Vet Candy, the destination for everything vet med. Launched in 2019, Vet Candy has grown from a weekly email newsletter into a modern veterinary lifestyle brand and an indispensable resource for the best veterinary education. Let me show you around our website, myvetcandy.com, and show you how to keep up with everything vet med. First, let's check out our homepage. We have some great stories to keep you up to date on the latest clinical updates, scientific news, and expert lifestyle tips. We also celebrate amazing people who are making our world a better place. This is my favorite part. For those of you that are looking for exciting veterinary CE, look no further. We have some great stuff for you, and I promise, no PowerPoints and no webinars because we do things differently. Maybe that's why we have more than 1 million views. Now let's go to CE On Demand. Here you will find videos that are all race, New York State, and CPD approved for veterinary education credits. Vet Candy is the streaming platform where veterinary professionals can learn from the world's most exciting experts and top influencers. Stream anywhere, anytime, and at your own pace. What I love most is that our videos are studio quality, shot and edited in 4K so you can stream them in 1080p. And best of all, Vet Candy's entire collection of more than 75 continuing education videos can be streamed anywhere, anytime, for free. And you can also select up to 12 different languages to watch them by selecting the language of your choice in the subtitles. So, how do you get your CE credit after watching an eligible video? It's simple. All you need to do is watch the video and then pass the quiz. Click on the Take Quiz button. This is the button below the video that takes you to an online test. When you pass the quiz, you will instantly receive an email with a PDF with your certificate of completion. It really is that easy. Next, we have a variety of Vet Candy original shows, from talk shows to rounds and games. There's something for everyone, and we are committed to bringing in diverse voices and unique perspectives. Let's look at our master courses. We have 4 master courses right now, and more are coming soon. We have ophthalmology, which is taught by veterinary ophthalmologist Dr. DJ Heusler, toxicology, taught by criticalist Dr. Carrie Hemmelgarn, surgery, taught by board-certified veterinary surgeon Dr. Philippa Pavia, and respiratory disease, which is taught by Dr. Anthony Gonzalez. For our master courses, there are 8 modules for each course. Watch each module and then click on the link that says Take Quiz, and it will take you to an online quiz. When you pass the quiz, you will receive your certificate of completion of the course, plus a link to download some tools to help you celebrate and share your accomplishments. You just click on that link and it takes you to the tools. So that's it for the tour of Vet Candy. I hope you enjoyed it, and thank you for watching.